We welcome you back to our program, and of course our show on Thursday is brought to us by Kaiser Permanente. One of their doctors joining us on the program today, Dr. Wendy Colling. We welcome you to the program, Doctor.
Thanks, I'm glad to be here.
You're in primary care, which means I guess you see little kids to us older folks and everybody in between, and kind of that, I guess we use the word gatekeeper. You're the primary physician for a lot of people.
Yeah, I practice in primary care. So a lot of primary care doctors will see people from birth all the way up into our seniors, and I generally see about 12 years old and up.
Okay. Now, you're down at the Mission Viejo office, so I'm sure some of our folks have probably already visited you.
Yes.
But I know a lot of people are making changes right now in their health care, maybe going with different providers, different companies. Doctors work a long time, but they eventually retire. We all have to go through that process of, gee, I'm going to hang up my practice or move to Colorado or something, so we have to change doctors. For that first visit, and it's always like a get acquainted time, but it's also from a medical standpoint important. Give us some recommendations. Say we're coming to see you for the first time. What do you like people to do and plan ahead for?
Sure. Well, it's real important to be prepared for that visit. I recommend that you bring a list of all the medical problems that you have, and if you've had any procedures, any surgeries, the date and the details of those procedures. I also think it's important for us to know about your preventive medicine measures. For example, when your last mammogram was, when your last colonoscopy or flexible sigmoidoscopy was, what the dates of those were and the results. And all your vaccinations, at least your recent ones, if you've had the shingles vaccination, your Pneumovax, your flu shot.
Okay, so kind of an update on where you are in your medical care. A lot of people maybe have a lot of questions, and I know as we get older we tend to want to write things down, and I'm sure you've had people walk in with their notebook.
It is. It's actually great if you bring a list of questions, because we can, if you have a list, you're not trying to recall them just off the top of your head. We can generally go through that list pretty quickly. You can get a lot of the answers you need. So bring a list of what questions you have. As far as your different problems and issues, we generally recommend that you try to keep it to 3 or less so that we can adequately address all the details of those, and try to bring up the issues that you want to talk about right at the beginning. So if you have questions you want to talk about, tell your doctor right off the bat, I'd like to go through some questions, but then I have these 2 issues that I'd like to do. And that way the doctor can allocate the time appropriately.
So we as a patient need to prioritize what our concerns are. But you may find that 1 and 2 aren't that big of a deal, that 3 and 4 are really the ones that you're more concerned about.
Exactly. I have some patients who come in and the first 2 or 3 things, they're worried about a rash, which of course is a concern. They're worried about their toenail ingrown. And then at the end of the visit, as they're walking out, they mention the chest pain they've been having for the last 2 or 3 weeks. So really, if you can bring these things up first, it gives us a chance to figure out what's most important and what can be most life-threatening or concerning. We can address them right away.
And obviously, with the number of patients that you probably see on a daily basis, we'd all like to have an hour of your time to just, share and talk, and you don't have that hour. You have maybe, 10, 15 minutes, probably at the most.
Our appointments are 20 minutes for primary care. For a regular routine visit, for more of an urgent care visit, they tend to be about 10 minutes. And that's pretty typical for most of the physicians in the community, even outside of our organization.
Okay. You mentioned bringing a list of medications. Would you rather have a typed list, or would you rather us bring in a box with all our pills in it?
At least initially, and each doctor's different, but for your first visit, I would gather everything up you have in the medicine cabinet that you're taking, over-the-counter medications, herbal medications, all your prescription medications, because I've noticed that sometimes when people type it out, the dosage gets mistaken, or sometimes the whole name isn't written and the other half of the name can be important. So all of those parts are real important.
So you want to look at those actual little yellow bottles that we get from the pharmacy and say, okay, why are you taking this? You might ask us that, and hopefully we'll know.
Yeah, and you may not know, but that's kind of the mystery that we'll work on and we'll figure out. And if need be, we can. And we usually do try to get the records from the old doctor, but they might not be there by the first appointment. But if you bring that, and I just say brown bag them all. Go grab one of the plastic bags or the brown bags under your sink, throw everything in, and bring them in, and that way we can sort it out.
And you not only want to see prescriptions, but if someone's taking fish oil capsules, if someone takes something for arthritic pain, if someone's taking something that they may have read an article about in a magazine that says this is going to help me X, Y, or Z, you want to see what we're taking, everything really.
Exactly. A lot of these over-the-counter herbal medications can be very helpful, but some of them can also be harmful or interact with the medications you're on, and so we need to know all of those.
One thing I've noticed lately, and other people have asked about it as well, a lot of times on a prescription you'll say, do not take with grapefruit. what's the deal with grapefruit in our prescriptions? What's the downside of that?
Sometimes it can have a negative interaction, particularly with some of your cholesterol medications. And because of that potential negative interaction, we don't want you to take it. That tends to be most common in, the most common medication that we'll see that with is our statin medications, our Lipitor, our Zocor, our Pravachol. Those medications and the generics of those can interact negatively. And so they'll discourage using that.
So that's not saying we can't have grapefruit at all. They just don't take it maybe in proximity to that medication?
Well, in general, actually, we like you not to be
Really?
taking it at all when
Okay.
you're on them. Yeah. Now, you can talk with your doctor.
Yeah.
Some individual doctors will
Right.
give different recommendations,
Right.
but in general.
And pharmacists are a good source on that too as well. But the
they
doctor that
definitely
prescribed it obviously would be the one you want to
Yeah.
talk to on that. All right, so what are some other things we should think about for that, especially for that first visit or any visit with our doctor?
As far as well, let's see. Like I said, the main thing you want to do is make sure you have a list of questions. Make sure you've brought in all your medications. Make sure that you've really kind of focused on what top 3 issues that you want to cover, and prioritize, if you're not able to get to everything, what's most important to you, so that we can try to get to those. The one last thing I would mention is try to think about who you need to who you would want to have access to your medical information. This is very important because a lot of times adult children will call and say, you know, my mom saw you, I need to know the details of this. Legally, we're not allowed to discuss this unless we have permission with you, and some people do want us to discuss it, and
Yeah.
some people don't.
Yeah.
And that's perfectly up to you.
What about bringing somebody with you, an extra pair of ears and eyes?
It's not a bad idea. I mean, that's another thing that's up to you. If you're okay with them hearing all the details of your medical history, that's okay.
Sometimes a spouse or a
Yeah.
family member, a son or daughter, might
I
provide a better insight.
The other thing is, too, you get a lot of information at a doctor's visit, and a lot of times you'll only remember 10 or 20% of that if you're not writing it down, and so an extra set of ears can help you remember
Right,
that.
right. A little bit about yourself, your background, how you became what you've become.
Yeah, I'm actually from the East Coast. I went to medical school at Eastern Virginia Medical School, and then they have a unique program where you can double board in family medicine and internal medicine. So I stuck around there for that. It's a 4-year program rather than the traditional 3-year for either the individual, and I loved it. And now I've found my way out to the East Coast in Kaiser Permanente, and I'm
Yeah.
really enjoying my job.
Right. So while you're a primary care physician, you also have some internal medicine training as well, so you can kind of bring that into the mix.
Yeah, well, internal medicine is primary care too. Now you see some internal medicine trained doctors going into the hospital and some staying out, some doing a blended position. As we see more the division between the hospital and the outpatient, sometimes you'll...
Right. Another question that people might ask too, especially that first visit, they'll go, you know, in my previous medical plan, I had a cardiologist, a gynecologist, you know, pulmonary specialist, you know, et cetera, specialists and subspecialists. Should they automatically assume you're going to send them to some of those people, or in some cases you may handle some of those cases?
Not necessarily. I mean, each primary care doctor is going to have different comfort levels with different disease processes. And they may be able to handle, excuse me, they may be able to handle the cardiac problems, they may be able to handle some of the gynecology problems. So as long as these issues are stable or the doctor feels like they can handle them, you might not necessarily need a referral to those specialists.
Okay, so kind of an individual case, individual doctors, and some are more comfortable with these areas, and others will say, we'd like you to go see Dr. So-and-so down the hall or in the next
Exactly.
building. Dr. Colling, thank you so much for joining us. Appreciate you coming by today. Thank you.
I enjoyed it. Thank you.
Good to have you with us. You know,
Thanks.
that's important, that first doctor's visit, and again, some good information coming our way there. If you want to find out more about Kaiser Permanente and the good services they provide, there's the number on your screen, and they'll give you more information there. 932-2052 is the local number. It's a local call, and that's right here in Orange County. You can find out about their programs and, of course, a brand new hospital they have in nearby Irvine as well. We'll be coming back with more local news and more guests as our program continues for today.
Kaiser Permanente. Thrive.